Thank you, Devin. World Hepatitis Day is recognized annually on July 28th, which is the birthday of Dr. Bloomberg, who discovered the hepatitis B virus in 1967, and 2 years later developed the first hepatitis B vaccine.
And today, Nurse Christina Paris is here to talk a little more about hepatitis, so thank you so much for coming in today.
Yeah, glad to be here.
So first off, what is hepatitis, and are there different types?
So there are different types. So when we talk about hepatitis, it really is just a fancy word for inflammation of the liver. And there are viral, your hep A, B, C, D, E, and there's also drug-induced. So today we are going to focus on drug-induced hepatitis. But really quick, I want to talk about the liver. So the liver is the largest solid organ we have in our body, and it has like almost 500 functions. So it's very complex, very important, and we can't live without our liver. It has, and I'm just going to read them off because there's a lot of just the bigger things that it does, just so people are aware
when they want to. All 500 of them?
No, but when we want to protect our liver. So it's very important in bile production. It absorbs, absorbing and metabolizing bilirubin, and that's what kind of can build up and make us yellow. Supporting blood clots. It's important in fat metabolism, metabolizing carbohydrates, vitamin and mineral storage. It helps metabolize proteins and break them down for digestion. Filters blood. That's the biggest thing. It is one of our biggest filters. So it's the biggest washing machine we have in our body. Our kidneys are the other one. It is really important in immunological functions. So meaning it has big immune activity. It's involved in that. The production of albumin and synthesis of angiotensin, which is what can help with the kidneys. So it is a chemical that goes through your body that tells your kidneys to function and work. And anyway, so there's a lot of big functions. But again, we're talking about the liver, we're talking about hepatitis. You had mentioned hepatitis C, and that is a viral infection. And, some of our veterans may be aware, because we talked about it, we were testing everyone just a few years ago, because the Vietnam era veterans were at higher risk because of possible IV drug use or even getting blood transfusions. We didn't test the blood like we do now when people were getting transfusions, and tattoos, getting tattoos from places that probably maybe weren't as sterile or didn't use proper techniques for cleaning. So those are the big things. But today we are going to focus on drug-induced hepatitis. So this is a type of hepatitis that is caused from using drugs that wear down your liver. So again, the liver is the filter. So drugs can be really important, and some of them can affect our liver, are harder to process, are harder to break down. And it's not just medications, it can be vitamin supplements as well. So that's why it's really important that you tell your provider what medications you're on.
Makes sense.
I know, that was a lot to explain the beginning. Big intro.
So all of that about hepatitis. Now, tell us a little bit of the symptoms.
Yep. So the symptoms, you're going to, a lot of people might have absolutely no symptoms at all, actually, and it's just discovered incidentally, maybe when they go in for their routine lab work. So we can check your liver enzymes, the AST and the ALT. That will let us know if there's something going on. But people will have belly pain, nausea, vomiting, maybe just not feeling well. Some people will notice that they're turning yellow, like the whites of your eyes may seem yellow, or your skin may seem a little yellow. With people who have darker skin, we look more to the whites of the eyes to see what the color is to determine the change.
And then, is there anything that can be done to treat or even prevent from the beginning drug-induced hepatitis?
So, the biggest treatment really for this, for viral hepatitis, we have come up with treatments for that. So there are medications that it's amazing breakthrough. But for drug-induced, you really want to find what medication is triggering it. Be very careful. If you're taking cold medicines for COVID or any flu or cold or aches or pains, Tylenol or acetaminophen is really exceptionally hard on the liver. And cold medicines have have that same ingredient. So if you're taking Tylenol for your pain and then you're also taking like NyQuil cold and flu, be careful, read the labels, make sure that you're not doubling up on that medication. Talk to your provider about your medications. At the VA, we have pharmacists who have PhDs. They're amazing. They will go through all of your medications. They can review ones that are difficult. Metformin is another one we watch really carefully with people with liver failure. So talk to your provider, know your numbers, and yeah, continue to monitor.
Interesting.
Fantastic.
Yeah, so thank you so much for coming in and kind of explaining all of that, because definitely a lot goes into it to make sure we have healthy livers with over 500 functions. We want all 500 to work.
Yeah, right.
But thank you so much.
Absolutely.
And coming up, we have What's